Okay, so good afternoon, everybody. Just give everybody a couple more minutes just to come through, just to make sure we're all in the right place, which is the Innovation Network for Health and Social Care, and 27th of July. They're all in the right place. Just give everyone, as I said, a couple of minutes to come through. Hopefully you've had the notification that we're recording the session as we do, just in case you don't get time to scribble down notes or contacts that you make during the session. We've got some great speakers this afternoon, some great information sharing. Please do use the chat to ask questions, introduce yourselves, share information, and we will be taking questions after each session. We will come to you, so if you want to pop your question in the chat, and then we'll come to you individually to take those questions as well. Okay. So we'll kick off because we've got a packed afternoon this afternoon. It's great to see so many of you join us. Yeah. Ooh, not quite sure who that was. Our fantastic comms team will keep admitting people in the background. So I'm Dee Puckett. I'm head of value-based healthcare at the Hub. Well, I am at the moment. So I've literally taken over hosting the Innovation Network just for this opening part. Since we have started and established the network over 2 years ago now, I wanted the opportunity to say thank you for joining, thank you for growing the network, but also to share the exciting news that I'll be moving to Cwm Taf University Health Board as their head of value-based healthcare. I'll still be working with the Hub and I'll still be a member of the network, but I just wanted the opportunity to say thank you. Thank you for helping it grow. We've got a brilliant steering group who'll be working with my colleague John, who you've all met in recent meetings, to take this forward. And on with the show. Now, before we start off with our presenters, Mark Briggs, I understand you're in the room. Fantastic. You're going to share some information about the innovation survey that you're currently running. Over to you, Mark.
Oh, great. Thanks, Dee. Yeah, this was really just to sort of reach out to any of my colleagues within Cardiff and Vale, but also possibly to reach out to other organisations, be they health boards or not. Basically, what we've been doing is we're trying to reach out to our colleagues within the health board with a very basic survey, just to try and understand what they understand by innovation, maybe what some of the blockers are that they've found. Do they feel that they're supported? Do they realise that there's actually a team forming to support them? And, you know, not at this stage important necessarily, but are there any particular areas of focus that they would like to sort of highlight going forward? So we've actually had a reasonable response given the normal response you get to surveys within the health board. I think we're more than sort of like 3 times the normal response level, possibly influenced a little bit by offering a prize. Anyone that responds gets into a prize draw, so recommend that for others. But so far, what we're seeing is actually quite interesting. Yes, there are people that don't know we exist, but actually there seems to be quite a lot of support from the line and management in certain areas, which we didn't anticipate. Anecdotally, we'd heard that was a little bit more of a blocker. So it was just to encourage any of Cardiff and Vale colleagues who may be on the call to sort of complete the survey. That would be appreciated, because we can't react unless we know what your thoughts are, but possibly also open up in the chat or elsewhere if other organisations have completed surveys. I'd be really interested in understanding what their results are. Unashamedly, we'd copied some of the format from Public Health Wales and Mark Griffiths, so I know there's at least one other NHS organisation that's taken the same approach, but there may be others. If so, please get in touch.
Brilliant. Thank you, Mark. And I'm sure Mark will pop his contact details just in the chat so that you can reach him. I'm aware that some other surveys have been going on across innovation in health boards, so it'd be great to link up. I'll put my contact details in the chat function. Thank you for the congrats. They're already coming up. That's really very kind. And I will pop my LinkedIn and my Twitter links up, but I'm not going anywhere particularly. I'll still be around. Moving on, it gives me immense pleasure to introduce our first speaker, Dr. Alan Wilson, whom I personally have had the pleasure of working with for, we'll both hold our heads down, for about 15 years, but much more closely over the last year working on this amazing piece of work, achieving innovation. And Alan will share with you some amazing resources which are now available for everybody to help us on this pathway. So Alan, over to you.
So thanks, Dee, very much. And can I add my congratulations, really well deserved. You will be a major force in Cwm Taf, just as you have been everywhere else, and they're very lucky to get you. So good luck with that, and thank you and other colleagues at the Hub for the support you've given me. Looking around the call today, I hadn't realised I knew quite so many people. It's lovely to see familiar faces and also names of folk who I know are working in this space. So I hope what you hear from me is going to be useful and of interest. I'll speak for about 20 minutes and then it would be great to have a conversation as part of the meeting. So what I'm here to do is to describe to you the resources which the Life Science Hub commissioned something over a year ago and which are now fully available. And I hope some of you have looked at the resource online on the site. The resources are really part of the Hub's overall role to encourage effective working between industry and the service, and to do that in ways which benefits the people of Wales. And very much I take my lead in this from the parliamentary review, which really described the need for innovation, the fact that we have services which are not fit for future purpose, and the fact that we've got to find ways of constantly reinventing services to make them appropriate to people's needs. So what's in these resources? Well, there's really 5 main elements. There's online there. The major part, which I'll focus on a bit today and which occupied most of the preparation time, is really a summary of research evidence. And that's there. It's called a narrative review. And I'll describe a little bit about what that's all about. We also attempted a policy review. Naively, you might think that policy is all part of some coherent whole. That's rarely the case. What we have tried to assemble online there is a resume of current policy that's relevant to innovation. I'm aware that there are currently further reviews, so this will change over time. We also put together a directory of support organisations. Again, I'm aware that's not unique. Our focus here was to try to flag up those organisations which have resources, money, expertise, which are specifically funded to support partners in Wales and which are available. We've also put up some blogs, and we'll continue to do this. I say we, I've now left the Hub, but we continue to work together as a family. So these blogs are essentially what happened when we took the summary of research evidence to key stakeholders right across all of the sectors and asked them for their views, their current experience of innovation, what gets in the way, what they thought of the resources that we were thinking of putting up. So those blogs are there online, and as I say, will continue to appear. And then there's also more links to the existing life sciences resources from the hub. So what's this all about? Well, if you'll forgive this rather crude diagram, it's supposed to illustrate the fact that we all work in our sectors, and we work, we practice, we gather knowledge, we learn from that, we use that experience to influence practice, and so we move forward. And as you will see or know, I'm incredibly aged. Most of my career I've spent in the health service. That's very much the cycle I was engaged with. There were very few opportunities to really look at. There's another group of people who characterize media, and what they do is they take fascinating bits of practice, they develop academic questions, they do usually well-disciplined scientific study to develop knowledge, and then they publish. If you look at the average paper that's published in a UK journal, the number of people that actually read even famous papers is very small, often handfuls or dozens. The number of people that download is still fewer. And the problem with all this knowledge is that it stays there, it stays in publications. And that's a huge waste of learning and what could be accelerated practice. So what the hub have really been engaged with and have asked me to support is how do we mobilize existing knowledge largely from academia so that it's summarized, contextualized and available for people to apply to practice. And so really the steps have been those two, summarize and contextualize. Being an academic now, I'm only really entitled to summarize. I can only take knowledge from academia, I can read it, I can make it available, hopefully in readable form. But what I'm not entitled to do is to then take that knowledge and say, well, this is what person X, person Y, sector A, sector B must do as a result. That is their job. They must contextualize that knowledge. What we have tried to do, and the hub's partnerships and resources are a great opportunity to be able to do this because they're precisely in this space, is to actually orchestrate constructive conversations about, well, how do you contextualize that knowledge and apply it to practice? So the first part of the job, and you'll see this in any academic work which attempts to access the literature, was to actually go out there, sift the literature and include relevant papers. So starting from over 1,000 relevant papers, we homed in on just over 90 resources which we've included in the narrative review. The narrative review that's published includes three main things. First off, there's a summary by Tricia Greenhouse, a forward by her. I've said that academic knowledge tends to stay in publications and academia. Tricia is probably the foremost example of an academic who measures her worth on the basis of, is her knowledge used? So if you don't know her work, if you get the opportunity to read any of her books, papers, and go to see any of her presentations, you will have a great experience. She's very practically focused and very wise in her advice. We've also included a lovely insight into innovation in social care because we realized and were made to realize that actually our focus, embarrassingly, was predominantly on healthcare. That's because a lot of us come from healthcare, but it's also the fact that a lot of this research is actually healthcare based. Some of it will be entirely applicable to social care, but the reality is that the research base for social care is not as mature. So we were not entitled to say quite so much about social care as we have been about healthcare. And fortunately, we have been able to feature really some current news about how review of that evidence is going in social care, and so you'll see that section in the report. The bulk of the narrative review fell into 14 themes. I'm not going to bore you to death I'll find other ways of boring you to death, but I won't bore you to death today by going through all those 14. They're there in the review. If you're so minded, then please do go and look them up. What did that research evidence boil down to? So this, if you like, is a summary of the summary. The first thing is that doing innovation in health and social care isn't easy, and it isn't simple. So it is a complicated problem in a complex sector. So it is not surprising that the answer to the question of how do we get better at innovation isn't a simple one-stop shop. It will need us to develop skills, expertise to tackle a whole range of issues over a long time base and to get better and better and better at it. It won't be just done quickly. The second thing to say is that the literature has a huge amount to offer. The flip side to that is that therefore not resorting and looking and gaining a good knowledge and working expertise of what's in the literature would really be irresponsible. We must look at previous learning because this has been developing over decades and it's quite mature. It's not complete, but it's quite mature. And some of it's very good indeed. The third thing to say is that there's just agreement right across the literature on this, is that we have got people who are capable of solving problems, and we have got ideas, we've got innovative hunches to follow. Our problem is substantially our organizational climate. We have not got a climate which engenders and encourages innovation, and innovation as part of the way that we work, and which is joined up with all of the ways that we work. The final thing to say that comes so strongly from the literature is that outcome focus is key to this. So if organizations don't know what they're trying to do in the long term and how their success and services will be judged over time, and if they're not measuring that, then they will not be capable of identifying areas where innovation is required, where step change is required, and therefore to sponsor, focus on appropriate innovation. So much for the summary of the evidence. Now what I want to do is to move on to how we have sought to contextualize, or more particularly to support other people to contextualize knowledge. And the first thing that we did, was the easiest thing, was to interview people. So we interviewed about 20 people across, as I said, all of these sectors, and we asked them the questions of what do you think of the review? This was pre-publication, and we've changed it as a result of some of that feedback. And we also asked people about what problems they foresaw in their experience in innovation. We also asked them what key themes were important to them. I just want to pick out, there are 8 themes which basically join up so many of those interviews. So lots of people said that actually it's more difficult than it should be to navigate the system. Healthcare and social care are too difficult to understand, and it doesn't have to be that way. The second thing that came up time and time again was frustration over spread. So that is to say that good ideas do not replicate, and sometimes that is for good reason. If people don't share the same problem, then they don't need to share the same solution. But quite often there were barriers in place, and very often culturally derived barriers. A massive part of the feedback in the interviews, and I have to say in the evidence base as well, is that there is a prevailing top-down approach to management of services, management of priorities, management of performance, and management of risk, and that stifles innovation. The point that I've already made is that there is a lack of clarity about priorities. What are we trying to innovate? We just don't want innovation for innovation's sake. What is it that is required? Again, a point that was made by people both in the service and in industry was that you don't get good at something unless you do it all the time. And what we should be after here is not a collection of shiny things, but the development of competence and regular habit. Culture came up lots and lots of times. I won't go into it. I'm not a great fan of just talking about culture as a nebulous entity, but we can get into that in discussion. Lots of comments about fashion and terminology, you know, people saying, oh, it's not innovation anymore, it's transformation. And of course, improvement went a long time ago, unhelpful. And 3 or 4 people who felt strongly, and you'll see how we've tried to respond to and assimilate that if you look at this part of the website. Some pretty strong feelings about the term Once for Wales. Again, pick that up if you like. So this is one of our interviewees turned into a blogger, and if you know Chris, you'll know that he's almost singular as a clinician in what he's been able to innovate and achieve in changing processes as well as products across the health service. But he doesn't describe his life as being a successful man. He talks about the frustrations of trying to get this done in a world that actually is not good at it, that doesn't have the habit of doing such things. So that was the easy part of contextualizing. What we've also attempted to develop, and we've just done it once, it worked reasonably well, but we want to keep going at it because we want to give you a reusable technique to develop and apply learning in local context. We call them roundtables. So we've used a known methodology which combines fishbone diagrams, so-called Ishikawa diagrams, to break problems down in terms of what are the symptoms of the problem. So in the interviews, people talked about problems being procurement. They talked about problems being risk aversion. They talked about problems being misalignment of organizations. So what this technique does is, okay, so we've got a problem here. What can we draw from those interviews about what people said were the symptoms? And then what we do is in a round table, which is a 2-hour, we did it online, an online meeting of about 20 people, is get small groups to take each one of those symptoms and apply what's called a 5 why technique. So if you take a symptom, for each symptom you ask, why does that happen? And then when you get that response, why does that happen? The aim is to end up with root causes. And the whole point of this is to allow people, and sorry, we can't claim we invented this, we're just taking a technique off the shelf and adapting it, is that it enables you to find problem-based solutions rather than reactive workarounds. And what we're trying to do here is to give folk in practice ways of thinking about current experience in order that they can pull down solutions which are appropriate. So what does this look like? Well, as I've said, we set this up taking problems and symptoms that we gathered from the interviews. The one that we've run so far was the alignment problem. And in colours here, you can see the 6 bones of this fish, where people were saying, well, this is what it feels like in practice. And then what we did was, working with them, tease each one of these out into whys and root causes. And diagrammatically, this is what they did. So for each one of those symptoms, starting with the dot, that's the symptom, they went through why chains to work out the reasons underpinning. And it looks complicated. We had facilitators from the hub who did a great job, but actually the process is very simple. We were able to work with 20 people online straight away without giving them a previous tutorial in how to do this. So for one of those, if the symptom is the partners have to do all the running to get an idea to spread, what did that group of 3 people say were the whys for this? So they said, well, the right partners aren't involved. The problem isn't understood. Why? Well, the people who should be involved aren't in place, encouraged and supported. Why? There's a lack of network and systems to bring them in place. Why? We lack knowledge to form the network and what to do. So hopefully you get the sort of picture of how that works. A slightly more complicated discussion. The group of 3 here talked about the NHS being confusing and impenetrable. And I can see one of our colleagues online was in this group, I remember. So they talked about 2 reasons why that might be. Well, the first thing they said was, well, they are confusing. The second thing is they said the challenges aren't described in a way that allows innovation. Well, why aren't they? Etc., etc. So what those groups did, the 6 groups, is to produce these diagrams. I hope you were reading those as they went past. And as I've said, we end up with this. So, well, okay, so how's that better than what we started with? Well, what we were able to do then with that result was to actually look at what was being said in each of these bubbles. And this color coding, a re-expression of that last diagram, shows that apart from a few bubbles which are in grey, we have actually aligned, or everything that was said in terms of 3 broad root causes. And so the hypothesis here is that those 3 causes are the things that need to be addressed if the issue of alignment is to be dealt with in local contexts. So what are these root causes? So the first thing is to say that service organisations don't give priority and resource to innovation. They're preoccupied by short-termism, performance measures and risk aversion. Root cause 2, there's no consensus about what the priorities are. So ergo, there needs to be consensus about what those priorities are before people can then get on to setting the agenda. Root cause 3, there's no long-term relationship, etc. So, okay, so if this was the outcome of the workshop, what should then happen? Well, for each of these, if one goes back into the narrative review, there are solutions which are available, as well as people's experience and practice and preferences, to help and inform the approach. So how should service organisations give more resource to innovation? Well, there's 2 things that broadly are available in the narrative review. Firstly, there is a lot of work in there which is about organisations actually assessing their innovation and improvement capabilities. In particular, we highlighted an evidence-based tool called Quasar. There are also resources in there which show how organisations should bring together management, improvement and innovation as part of a joined up way of managing a service industry, so not seeing them as separate. In root cause 2, we talk a lot about outcome measures. We talk a lot about quadruple aim. We talk a bit about value-based healthcare. We argue that those 2 concepts overlap quite a lot. And what we argue here is that as well as performance measures, there should be a real development of those ways of measuring in order to develop longer term agendas and a real approach to innovation. The third root cause, if you look in there, there's a section on networks. We particularly highlight, for example, a biomedical partnership in Oxford, where they do precisely this. They gather the sectors together in a learning environment. They gather them around the identified priorities which have been agreed across partner organisations in that geographical patch. So what I'm saying here is that we're using the roundtables as a way of supporting colleagues to take the summary of evidence and contextualise it into current knowledge. So in summary, the roundtables, I think they are also applicable at local level in a geographical patch, a good way to actually bring people together around current experience and what we need to do in terms of well-informed action. They offer a way of structuring a discussion in order to get consensus and also an outcome. This we feel is more useful than simply a workshop where people air problems. It forces people to think about solutions. It enables the solutions to be based on stakeholder experience rather than the hub or me or anybody else simply producing a document which lists actions for other people to take at the end. But it also means that knowledge from academia and elsewhere is available to inform actions. So finally, what happens now? Well, the hub will be maintaining the resources that I've listed and adding to them. They will also be proactively offering discussion of all those materials, further roundtables, and in fact, the roundtable itself wants to run further roundtables on the problems that I listed earlier. And I and the hub will be working with the learning academies for innovation and value-based healthcare to make sure that this material is incorporated into their teaching henceforth. So I hope that was helpful, useful, and I also hope that I've left some time for discussion. And thank you very much for listening.
Thank you, Alan. Hi everyone. So my name's John. So I normally host these sessions, but Dee took over at the beginning. But nice to see everyone. Alan, thank you very much. That was awesome. And I think I've been lucky because I've been able to take part in this over the past number of months, and it's been a great opportunity. Now, everyone who's on the meeting today should have had the link for the resource prior to coming into the meeting, and it is a fantastic resource. You know, there are some really interesting points in there, and I think there's little bits in there that you can dip in and out of, which is quite a nice feeling as well when you're looking through things. But I haven't seen any questions come through yet, so I'm going to open it up to the floor really. And if anyone's got any questions they'd like to ask Alan about the resource and the narrative review, please feel free to put your virtual hand up. And we'll come to those people who want to ask questions then. So does anyone have any questions for Alan? Okay. So Bill, hold on, let me get your official name from the chat. Do you want to ask that question yourself?
Yes.
Oh, fantastic. Do you mind introducing yourself? Is that okay?
My name is Bill McAllister Lovett. I'm known as a disruptive innovator, and I've built incubators and innovation hubs all over the world. So for me, does innovation on and of itself allow you to change? I've got experience that's all over the world, but I'll ask Alan to see what he thinks about that question. So thank you.
I'm sorry, the internet failed me a little bit halfway through your question, Bill. I do apologise. Could you try again?
Okay. Does innovation in and of itself make the changes you require?
No.
Thank you for that.
Absolutely not. I'm reminded of one of the Prime Minister's least fortunate expressions, which is spaffing against the wall. I think doing the interviews that I was privileged to do, I spoke to a couple of chief execs who I found really refreshing in terms of the way that they were trying to change the expectations and the climate of their organizations, and to communicate very clearly that what they wanted to see was change and innovation. Too often one sees innovation really stifled and smothered. So innovation of itself, I don't think is the key. That's why in one of the early slides, I suggested that the requirement is about how you engender the climate that creates that innovation. I hope that answers your question, because you asked really a question, which is the meaning of life.
Yes, yes. And for me, what you said was really interesting when you're having the round table. One of the key things for me would be the language games you have at the table and the sense of place there. So basically, when you're doing the round tables, that's really important. So thank you. That's a good answer. Thank you.
Thanks, Bill.
Thanks, Bill. Does anyone else have a question for Alan? Mark Matthews, do you mind introducing yourself, Mark?
Hello, Mark, and thanks Alan for the intro. That's brilliant. So yeah, my name's Mark Matthews. I work for a company called CareDirect Technology, and we specialise in social care solutions and to help in the healthcare segment. What was really interesting, I can see a couple of the challenges you've got is, you know, not really communicating with a lot of the third parties who have that level of innovation and, you know, prepared for the digital switch over. I'm just wondering, you know, so, you know, from someone in where I specialise, how can we help, you know, people like yourself into, you know, kind of showing you these kind of products and being able to kind of fit them in there to enable the users, etc. Just the kind of starting off point.
Okay, so if I strongly suggest you don't show me anything, because I'm a boring old man that works in a back bedroom and summarises the lecture. Understood. I would suggest that that organisations who run services for which your innovations are appropriate should be shining a light bulb and saying they are up for this, they are ready to communicate. I won't tell you how to do your job, but I'm sure as you trawl websites, etc., and look at news stories for organisations in Wales, it will be apparent to you that some are actually really getting on and doing this work, and others are not. And it is those organisations that I suggest are the ones that you take up with. One of the comments that was made in one of our sessions was that, and I don't think that this was addressed at your sector, it was really at the higher tech end of things, is that often industrial partners come with overdeveloped solutions before there has been a proper discussion about context and priority. Therefore, the earlier the discussion happens and this thing about partnership, the better.
Okay, thanks very much.
Okay, I think we've got time for one more question if anyone else wanted to ask one. Or Joe, you've just jumped in there. Do you want to jump in with your question, Joe Ferris?
Well, and I don't know if this is for you, John, and hi everybody, I'm Jo Ferris, I'm the Operations Manager at the Association of the British Pharmaceutical Industry in Wales. You'll have seen, obviously, the written statement at the end of last week from the new Health Minister looking at rejigging the way innovation is handled in the Health and Social Care Department of Welsh Government. And I just wondered how this work would be fed into what is being done there, and how you're planning to engage with that sort of audience, as well as the fact that innovation, evidence-based innovation, is one of the 6 priorities for the Health and Social Care Committee at the Senate. So again, another opportunity there. So just interested, John, Alan, whoever feels most able. Thanks, guys.
Alan, I saw you nodding away. I wonder if you had any thoughts on that.
So thanks, that's a great question. I suppose what I would worry about is if any national committee interprets its role in spreading spreading evidence-based innovation as a message that they need to identify the shiny things that need to be spread right across Wales and everybody has to use. I would hope that the message that would come out of this work is about capability and culture and outcome focus. So I'm sorry, I'm not answering your question. I'm supporting your motive in asking it. I think there's a lot here that could inform that review, and I worry that public policy is too often formulated around developing a set of bullet points that look as though we're doing something. And so I'm more power to the Hub's elbow in making this information available to ministers and civil servants.
Okay, thanks, Alan. So I think we're going to, thanks for that, Joe. Thank you. We're going to move on just so as just to kind of keep things moving along. So thank you again, Alan. And like you said earlier, I think this is going to be a something that's going to keep growing as a resource, and I'm sure that we'll see you as we move along with this in Life Sciences Hub Wales. And yeah, please do join us back at the meetings. And yeah, really interesting stuff. And if everyone hasn't had the chance to have a look at it, please have a look at the resource. It is a really, really good kind of read on many levels. And somebody put it in the chat for us, so thank you very much for kindly putting that in the chat. And please do go and have a little look at it. So thank you again, Alan. So
thanks, John.
So we're going to move on. Next on the agenda, so the Innovation Network, as some of you might be quite new to the Innovation Network today, to our meetings, and some of you I know from looking at the list of attendees have been joining us for a reasonable amount of time, and we are really kind of working quite hard in the background to establish what will be the kind of direction of travel for the Innovation Network, what that looks like, how it behaves, what the content, what the priorities are for us as a network, and all of you as members. And we, like Dee said earlier, we have established a steering group for the Innovation Network, and some of the members of that group are on the call today. And I'd just like to say again, thank you to all of them for taking the time to join us in those meetings. And the reason for that is that we really want to make sure that the Innovation Network is doing what it kind of set out to do. And for us, that is to kind of be to inspire and to drive and to showcase what innovation can be and what it is in Wales. And that is whilst bringing all different sectors, so that being healthcare, third sector, public sector, industry together to learn about that and also drive it forward. And we've had some fantastic conversations in those steering group meetings. But one of the things that we kind of talked about within those meetings was that over the past 18 months, we've had to kind of do this in a digital format. So normally we'd host these meetings as a day, and it would be in person, and people would get the chance to go and talk to each other in a much more informal way, and it was a really good way of connecting and networking. But we were really conscious that we were missing that over the past 12, 16 months. And one of the things that we've been doing is we've been working with one of our partners, Simply Do Ideas, and we've got the CEO, who is Lee Sharma, on the call today, who's going to tell us a little bit more about the work that we've been doing to see how we can utilise that space as a way of bringing the Innovation Network membership together in a much more continuous manner, so that we don't all have to. There are opportunities beyond coming together purely in these meetings and having to quick fire network and connect. So we've been looking at how we might be able to do that utilising the Simply Do platform. And Lee's kindly come along today to tell us a little bit about what that might look like and how that might act and what it might do to be able to kind of help the network develop and grow and communicate in a way that we haven't kind of got at the moment. So Lee, I can see you at the bottom of my screen. So like I said, Lee Sharma is the CEO of Simply Do Ideas. Some of you will be aware of them from other kind of challenge-based calls and other kind of as a platform for innovation and ideas. So Lee, I'm not going to take any more of your maybe what might be your presentation. So welcome to the Innovation Network meeting, and I'm going to hand over to you to tell the members a little bit about kind of some of the stuff that we've been talking about over the past 4 months or so.
That's great. Thank you, John. I appreciate the intro, and it's actually great to be here. And I think I've got tough shoes to follow, kind of coming in after Alan. So I'll do my best to fill the gap. So yes, it's great to be here, and it's great to kind of hear about some of the topics that have been discussed. And I think there's a couple of things that sort of resonated with our work. I think Bill's point around language was an interesting one. I think we like to throw around this word innovation quite a lot, and I think it's something that can serve to confuse sometimes more than help. Can you actually see my slides okay?
Not quite yet.
Okay, let's have a look again.
We've got a loading slide.
Okay, let's have a look. Bear with me a second. Love technology. Who'd work with technology? Right, bear with me a sec. I think I got to restart it again. Okay. Okay, let's try that again. Okay, can you see the slides now? Okay, I'll perhaps not try and go full screen, because I think that's what kind of corrupted last time. But yes, I think it's just interesting to hear the conversation around language that sort of Bill mentioned.
Lee, you're on mute.
I can't seem to go off.
We can hear you now.
Okay. There we go. Yeah, I think I was being muted. So can you see slides as well? Great stuff. So got there eventually. You wouldn't think I work with software, would you? So first of all, just a quick introduction. So I'm Lee Sharma, as John said, the chief exec of a company called Simply Do Ideas. I'm actually standing in for my colleague Joseph Murphy, who's been attending the network and been heavily involved in the work with John and some of the other stakeholders. So I am presenting his slides. So I'll do my best to kind of get through these and hopefully be coherent as we go through. But I think just a quick sort of run through of the format, and I think it'll take no more than sort of 10 minutes, then we can have a little conversation around it. I'll just give a quick sort of intro about us as an organisation, sort of very broadly, but really the focus is around talking about this, this kind of digital place where we can potentially network and look to perhaps explore that in a bit more detail, and then obviously look to move forward towards the next steps. So just a little bit about us, those that don't know us. So I suppose at our core, we're around making innovation accessible. And I guess what we sort of mean by that is around, I suppose the point around language, I referenced Bill sort of talking about language and innovation, is it sometimes can seem a little bit confusing and a bit inaccessible for some. And I think we've heard on the call already that, the opportunity sometimes can be difficult to get in with health boards and health services, because quite naturally there'll be, sort of risk averse, and I think that's kind of something that's kind of quite well understood. So as a platform, I guess what we're essentially trying to do is kind of extract some of these early stage ideas to some of the big challenges that we face, typically across public services, which is where our sort of our mainstay is. And I think I suppose the core point of our involvement today and previously in the network meetings and I suppose our purpose is around this kind of co-production of solutions, and it's something that has become very buzzy, I think, particularly over the last kind of sort of few years. But I think that there's actually a lot of challenges around that, a lot of difficulties when you're putting together, diverse stakeholders. So essentially what our kind of process and our product is designed to do is to make that process a bit easier and a bit more accessible for all those various stakeholders. To give an example of sort of the work that we do, so we work, for example, with ambulance services to extract employee ideas that are usually linked to kind of organisational strategic challenges, through to kind of the work we've done historically with the Life Sciences Hub Wales as well, around sort of connecting up with industry to kind of solve those kind of healthcare challenges, such as the one that we faced, last year with the whole PPE and demands of NHS shared services, which was obviously quite a difficult time. And just as a kind of, I suppose, as a point of reference, I don't think it's just the kind of public services or health and social care that's having these kind of almost challenges around trying to connect up industry to kind of bring out some of the best solutions. So one of our kind of biggest, sort of name dropping here, one of our biggest clients is Rolls-Royce, and something that they're really keen to do to kind of bolster their kind of innovation efforts is around just bringing together co-creators. So they're looking to connect up with small and innovative companies, essentially to try and, in the language there, to build on others' expertise. And I think there's something around this, we've almost got to leave our egos at the door here, because I think when innovation comes around, we've got to be kind of almost open to fail to a certain extent, but obviously understanding that we've got to mitigate the risk as much as we can do, and obviously there's ways to do that. But our kind of, I suppose, approach, and then I'll come on to kind of how this could be applied to this to the discussions around the digital innovation network, is essentially our approach is around challenges. So I think we've all probably seen, almost like ideas boards or ideas kind of boxes in various organisations. I remember the first company I worked with had one where you were just basically posting kind of postcards with your ideas. I think what we're trying to do very differently to that is around, rather than just saying, give us your ideas, this is around actually being sculpted around challenges that have got to be really clearly defined solutions. Back to kind of Einstein's phrase about, planning before you kind of start delivering the solution. I think that's really kind of pertinent, because you've got to make sure you're asking the right questions to get the right answers. And then once you've kind of got a challenge that's really sort of clearly sculpted, then you can start, and only then you can start sort of looking to kind of capture solutions around that. And again, and I think this goes back to a point that I think someone made earlier around that, ideas are pretty valueless unless you kind of do something with them. So it's around kind of managing those ideas through to a point where they can be delivered. And I think something that is often missed in this kind of, in the innovation landscape is around the emotional journey of going through this process when you've got an idea. So, for example, you might be an employee within a large organisation. It could be a health board or somewhere that is, has got an idea for some sort of process improvement. But actually, it's very difficult to sometimes communicate that idea because, you may not have the kind of the confidence, or you may not be able to kind of coherently, structure your idea in a way that will be listened to. So it's around being open to that, but also around, small businesses that may not have the capacity to engage with, with larger organisations as well. But I think bringing us into the network opportunity, I think, is really interesting. So as I mentioned, we've been working with the Life Sciences Hub for probably about sort of 12 to 18 months or so now, and the conversations have been really positive around how this, almost potentially around adding value to the physical networks. I think Jonathan sort of explained it really well there, and I think there's an opportunity to potentially be almost like, and this is a term that's just coming to my head, but a bit like the hammocks between the kind of physical networks where things can be held and, in a secure place, and where people can have those kind of, informal conversations. So I think just sort of looking at kind of, I suppose, what the sort of purpose of that potential, digital space might be. And I think that, the key ultimately is around, working together to make, the good ideas happen. But of course, that starts at a very early stage by just people connecting with each other. So you can imagine just in a digital space, it's quite easy for people to be able to create profiles where they can be quickly found. So you don't spend time trawling to try and find, an appropriate person to connect with. You can actually go through and connect with the right people. And ultimately, you want to be starting conversations with people. You want to be having those informal, exploratory chats and just sort of saying, well, look, this is something we're thinking about, and having that sort of safe space to be able to do it. And obviously, as relationships grow, collaboration becomes stronger. And again, collaboration, much like innovation, is a word that's thrown around quite a lot. But I think in the truest sense, it's absolutely relevant here, because we really want to be making sure that whether you're from the public or private sector or third sectors or any sort of part of society, you should be able to engage in this kind of innovation opportunity as well. And the main thing, I think, and this is something that's obviously worthwhile us being kind of very mindful of, is that we need to be making sure that the data is safe, that people are safe to share information. So being in a place where it is actually cyber secure is obviously really important. But just sort of talking a little bit about kind of operationally how this might work, and this again is up for discussion, and we'll be inviting people to express interest of being involved in it as well. But I think and it's quite small on screen, but to give you a bit of an idea, I'll sort of talk through it. But essentially, we've kind of got the challenges which will need to be defined can be shaped by members of the network, and they can go in and, as I said, informally connect with each other. But ultimately, it's around shaping those challenges to be as almost as well defined as possible before those solutions start to come out. So let's start talking about those problems in a safe digital space. And of course, a key part and the key power of the network is around having the right people there. So, individuals can register and, they can make sure that they've got their profile set up and be found. But ultimately, it is around the power of the network. So, if there's one person in it, it has no value. But, almost like the network effects, if you've got more people in it, it becomes more powerful. And ultimately, when you've got those key people in this network, then they can start sort of looking at kind of ideas and how those can solve the challenges that have been predetermined in the earlier stage. So it's kind of almost a bit like an end-to-end process. But, as a starting point, the conversations need to happen. There needs to be a kind of a place where that can happen, as I said, in the safe digital space. So I guess from an operational perspective, it would be a simple process of just accessing, the network portal. So as you would do with any kind of, network portal, you just kind of sign in and create a user account. What's key here is around creating a profile, because essentially the better the profile would mean, it's easier to find you and can obviously connect yourselves up with the right sort of opportunities. And then you'll have, again, making it quite easy for the users, because conscious that people don't want to go trawling for things. You'd actually have an activity feed. So if someone wants to connect with you, you'll be told, you'll be notified of that. So for example, you sign up on the mobile app, you'll get a push notification, or you'll get an email pop through to say, someone's interested in kind of collaborating or speaking with you, or they posted something interesting, or replied to something that you've said on a forum. But what I think is quite interesting here is around you can create the profile, but ultimately you can join different interest groups. So again, if you're specifically interested in working with academia, you might join a higher education group, but there'll be others set up and to be defined by the the working group before this is kind of rolled out. But what I think again is key is that rather than I go back to this point of going in and trying to find stuff, is that you'll actually be drawn into it. So say, I mentioned around if someone posts something interesting for you, but if essentially, there's a challenge that's relevant for you, then and that could get posted to you, and you could then sort of engage with that, enjoy the discussion as well. But just to say, the kind of Joe's put the text in bold in draft at the top. Now, this is just very much a kind of a work in progress in the conversations that he's had with some of the team as well in the network. So this is very much up for discussion. But I guess the ask for today from us is really around expressions of interest. So if some will be saying, well, actually no, I don't really not really sure about this, and others will be saying, well, actually it sounds really good. So I think those almost like early adopters, I think it'd be quite interesting to engage with them to almost shape how this might work. And again, it's all kind of up for debate, and ultimately it has to work for the people in this virtual room as well. But that's kind of me done. I hope I've done it justice. And I'll just stop sharing my screen to see if anybody has got any questions at all. There we go.
Thanks, Lee.
Over to you, John.
Yeah, thank you. And so this has kind of been something that we've been talking about for a reasonable amount of time with Simply Do, and it's but we want to make sure we get it right for the first time. And I think for me, from a Life Sciences Hub Wales point of view, and it's about, at its basic idea, it's about giving people a space to come together that is a digital space. And I think you know, we've got lots of people on this call from kind of, if we look at Wales, if we purely look at Wales, that from kind of all ends of Wales, and I think with so much knowledge and so much expertise, and I think it's about bringing all that knowledge and that expertise to a place where it feels safe to have that conversation. And I think, you know, collaboration and almost just starting that conversation beyond what we're doing here. So giving people the space to do that, but also creating a space where people who are quite new to innovation or new to this area can go and just observe and watch and read and almost take away some of that kind of the scariness of what can be innovation sometimes. So in its basic form, it's just a place for those communication and those conversations to start. And the bits that you've talked about there, Lee, about the challenges and the groups, that's kind of, those could be the next bits where we can kind of look to how we can then spark off some of those more kind of formal and those more tangible things that can come out of those conversations. And the platform is really good at doing that and housing that, and has the functionalities to do that. So we're going to start kind of building this and building it into something which will be the first phase of that. And Lee's right, we will be looking for interest for people who are quite interested in trying that and giving us feedback and about what that looks like. But we kind of want to start quite simple, and rather than make it the perfect platform and take a long time to get there, we just kind of want to get it out in a safe, digitally safe place, and get your responses and your feedback as members as to whether that's being helpful to you between meetings and during meetings. So Bill, you got your hand up again, and would you like to ask a question?
Yes. First thing, the Rolls-Royce slide on the ecosystems, that's just a wonderful example and narrative, because that's part of the work I'm doing at the moment. I'm using nature models to build teams. But secondly, I'll have to tell you this story. 20 years ago, I built something that you're building now. I was one of the first people in the world to build a knowledge cupboard. And it failed because everybody threw everything into the bucket. It became this wonderful portal called a bucket. But out of that, we actually sequenced it in the way you're doing now. So I have to congratulate you on taking it to a different level. And it'll work because you've actually put the key parameters in to allow people to find each other and not just say, how do I find it? You've got a push-pull mechanism, whereas I'm trying to find everything and I could be spending hours trying to find it. So you've taken to a different level. So thank you.
Thank you, Bill. That's really good feedback, and I think what's really interesting is, I think, and I don't know whether it's just because society has shifted a bit, but I think we become very quickly bored with things. So I think the days of where we would persevere to find the information we need are perhaps behind us. So I do think that things need to be made simple. I guess the clue's in our name, I suppose, but I think things need to be made simple. And I think, you know, bringing it back to the network as well, is that, you know, we're dealing with very busy people, you know, that have got busy day and often night jobs as well. So, you know, we need to be thinking about how they can access, you know, these innovation opportunities and connect with each other in a very quick and easy way. I think that's what Jonathan's sort of talking about. And I think it needs to be, you know, getting those informal conversations out as a starting point. And we almost, you know, in the spirit of lean innovation, we almost see where that takes us to a certain extent. So, yeah, I mean, it's something I'm really excited for us to be involved as a company, but also on a personal level, it's really exciting as well.
Thank you. Thank you.
Thanks, Lee. And I think, you know, the other thing is that, you know, what we're not saying is that this will completely take over in-person meetings. You know, we do know that when we're in a safe place where we can do that and, you know, and come back together, there will be absolutely a time and a place to do that. But like Lee said, you know, we're well aware that people have got busy lives, busy jobs, and lots of things to be doing. And this just is something that we want simmering in the background, where you can dip in and dip out, and it can be a place that facilitates and enables those kind of things to take place. at a time that is convenient for that person. So it's a moving picture, and it's really exciting that we can, we're in a position to work with Simply Do, and the membership is able to kind of contribute to this. So my email is on the screen there, and it'll be as part of the thank you email after this meeting. So please do get in touch if you're interested in helping us shape that, and the steering group will also be involved in shaping that as well. So thank you, Lee.
Thank you.
Okay, so the next part of the agenda, and part of what I was just talking about there is getting people communicating, getting people talking and connecting, and we're really keen to do that as best as we can. But we're also really keen to find out from you as members. Some of you are new, some of you are kind of been coming for a reasonable amount of time now, about what the Innovation Network means to you, and what it can be in the future, and how we can help you, inspire you, and how we can help drive you as innovators and as members of the Welsh health and care system, industry sector, and all of the above. So we've spent some time in previous meetings asking about why were people brought to the meeting, and what drew you to join in the network meetings, and we've got some really good kind of information that came out of that. But what we kind of want to look at now is a bit more of the detail, and what we're going to do is we've got some time put in the diary here now to put you into some breakout rooms, and we've got some fantastic presentations that we've got another 3 more presentations to come after this. So it's, we're just going to break things up and mix things up a little bit. So we're going to Priya, can you please put the slide with the questions on? So we're going to what we're going to do in a few minutes is we're going to break everyone out into equal randomly generated breakout rooms with about 8 people, hopefully, in each room, and we're going to ask you to get into those rooms, and if someone feels happy enough, maybe those who have been coming for a bit longer, just to kind of almost chair and facilitate that room and get the conversation going. We're going to have about 20 minutes, and please introduce yourself and do a bit of a round robin and say where you're from and what you do. But essentially what we'd like you to talk about are 3 questions, and this is about trying to help us inform us as the hosts and the steering group for the network about what we should be delivering, and how, what is it that will help you move forward as innovators, and drive and inspire you as innovators moving forward. So there's 3 questions, and it's essentially that we want you to think about, as individuals and organisations, what do you want to see and hear from the network and its members that will inspire you, that will drive you, and that will inform you. And I'd just like you all to spend some time thinking about that in these groups, and please just let the conversation flow. But what we're going to do at the end, we're going to pull you back in, so you don't need to press a button at the end of the 20 minutes. We're just going to pull you back into the main room. So sometimes people click the button and they've gone for the rest of the meeting, and we cut in half sometimes, and sometimes that's due to the wrong button being pressed, so don't worry about that. But we just want to have you to have that conversation. And then what we're going to do when we bring you back into the main room is we're going to have something called Menti, and you're going to need your phone or the second screen if any of you are using second screens. And we're just going to get you to put some of those thoughts into our Menti poll and our Menti survey. And what that's going to do is it's just going to inform us as the steering group to think about, okay, well, what is it we need to bring to the meetings? What is it we need to bring to what may be this Simply Do platform? What are the conversations that we need to be starting that will inspire you and drive you and inform you in a way that really helps us innovate and drive that across Wales for our patients and our population? So just bear with us. So hopefully, so it's those 3 questions. Someone's going to need to make the first kind of move and introduce themselves, and if everyone in the room can do that, because this is just another opportunity to bring you all together and get to meet each other in a way that we would normally do in a physical space. So we'll bring you back after about 20 minutes, but it's just about what that content can look like and how we can make the most of this time to really inspire you and drive you as members over the next 12-18 months as a network. So Priya's going to
now.
And suddenly he was gone.
Oh. Don't know what happened there.
I'll just get going then.
Okay, so I don't know if any of you were like me then got cut down in your prime, but
yeah.
Can I have a refund?
I just light a torch.
Yeah, and so just to come back to what we were talking about, you know, if I take the simply do that example we were talking about earlier, we do have these little breakout sessions every now and then, and what would be lovely is if we could go offline and continue those conversations, and that's kind of something we were, you know, that the idea of this is to kind of give you that space. So as is the way with the breakout sessions, we do lose a few people off the back end of them. So, but there we go. That's how it is. So we said that we were going to get people back into the room and start to ask you to use Menti. So Menti, if you go to menti.com on your phone and use the code 72281530. So it's on the top of the screen that we're showing you on the slide at the moment, and it'll give you the opportunity to start putting in some of those things that you may have discussed about what may inspire you as members and as organisations. And it's just for us to kind of take some things to go, you know, have some things to go away with and have a little bit of a think about that. So there's some really nice things on there already, which are, you know, things that have worked well. You know, things people have learned, so those learned lessons, we talked about that in our room, things that have bombed, and again, you know, things that didn't go well. You know, we talk about, you know, you do take a risk when you do some of these things, and not everything can go rosy, and I think it's about being safe and okay to share those learnings and those outcomes, because there will be a number of projects and examples that don't go well, and that's okay. It's a learning phase and it's a learning curve with a lot of this. So it's menti.com. So some people may get caught into going into Mentimeter, but it's menti.com, and the code is 72281530. And it's just thinking through those things that if you kind of came to the meeting and you were watching, and what would really inspire you to go away. And it may be, yes, we got case studies, we've got examples up there, whether it's, you know, those lessons learned, or whether it's, you know, things from abroad or outside of Wales. And just have a little think about and you feel free to put as many things up there as you want. I think there should be an unlimited amount that you can put up there. But what this will do is help us kind of when we go away and start kind of really pulling together the program over the next 6 to 8 months and with the steering group. So yeah, there's some things that really come out. So case studies, you know, ideas, opportunities. So some of those things that will come out as opportunities from the innovation space. Yeah, people are coming back in now. So again, put out through a door, a fire exit is the example of that, isn't it? When you're in a meeting and someone just walks you out the fire exit and then you can't get back into the building, I think. So, okay, fantastic. Wonderful. So, yeah, some really nice things coming up here, and you know, new interventions, practical examples. Okay, case study seems to be the bigger one. So this the ones that are bigger and more standout are kind of the ones that are probably being talked about a bit more from you as examples. Okay, wonderful. So the next one is very similar, and it talks about what will inspire you. So if you look at your phone now, you'd be asked, you know, what will drive you? What will essentially drive you as members? And I think it's a similar thing. People are popping back in.
What will drive me?
So rather in the physical term of drive you, but as an individual and organisation within this space, you know, what would really kind of push you to move forward and drive you as an innovator? Okay. So opportunities to collaborate, lovely. So mentoring and you know, sometimes from networks, you know, or coaches, you know, sometimes that can come when you develop these relationships within networks like this, and you do start to meet people who are new to you, or have similar ideals and similar values and some similar interests, then you will kind of develop relationships where I think some of that, you know, that learning may come on a network level, but it might come on a more of a personal level as well. Like, you know, maybe as we develop those relationships in the network, that some of those things may come out. So being set challenges, okay. So we talked about the Simply Do platform and how there may be opportunities that challenges may be able to form challenges, and we currently use the platform in Life Sciences Hub Wales for it with that in mind, that we use it to set challenges to industry, and some of our partners within the health boards and elsewhere are going to, you know, there's going to be opportunities to do that in partnership with us in the coming months and over the next year. Okay, peer support, and some of these things that are coming out of this are some of the natural effects of networks, and when it's a really well flowing network, then some of that support and that collaboration and those mentoring states do come out of that. So it'd be really helpful to see if what we can set a place and set the scene and the conditions for you to do that. Okay, so we'll move on to the next one, Priya, and this is the last one. The next one was just about informing, what are the things that you want to hear about, and what will really kind of, you know, we've brought Alan in today to talk about the Achieving Innovation resource, and we've got some fantastic speakers coming in after this now, after this break, this finishes. But again, what will really inform you? Is it going to be about research or radical innovation? So that first one popping up there, fantastic. So, you know, what is completely disruptive? What is completely new? Okay, so challenges. So again, we talk about, Alan talked about the priorities as part of the Achieving Innovation paper, and understanding what is top of the priority, you know, what are the top priorities. And I'm sure over the next, over the coming months, there will be, and there will be opportunity for us to kind of reflect and get a better idea of that across all organisations and all sectors. Trends, okay. So cross-sector innovation, that's really interesting. We talked in our group about kind of the bridge between care and health, and whether a good opportunity, you know, whether a good examples that of collaborations that have taken place, and the synergy between the priorities of those kind of two sectors. So resources, okay, case studies, expert questions, okay. Some really interesting stuff coming out of this, and this will really kind of help us shape what we're going to be looking at as the building the content of the coming meetings over the next kind of 12 months or so. Okay, wonderful. So I'm going to move us along. Thank you everyone for kind of contributing to that, and I hope you all enjoyed the time in the breakout rooms. It does help to get people into a room and speaking to each other, because I think that's what this is about. You know, it's about helping you meet each other, get the chance to talk to each other. If I can ask everyone to mute yourselves, just so we don't get any feedback, and because I think when we come back into the room, sometimes it can unmute you. So I'm going to move on to our next presenter. So I can't see. We've got Dr. Megan Mathias. There you are, Megan. Hello. Who's joining us this afternoon. So Megan is the CEO of the Moondance Cancer Initiative. She's kindly agreed to come and tell us a little bit more about the Moondance Cancer Initiative and some of the opportunities that are out there at the moment that are coming from this initiative. So I won't take your thunder again, Megan. So I'm going to pass straight over to you. Are you happy to share your screen with your presentation? Is that okay?
I was hoping Priya might be able to run it for me, just so I seem to be having issues. Is that possible?
That's absolutely fine. I can just bear with me a moment.
Okay. So if you don't mind saying next.
Yeah, I'll do the whole next.
Yeah. Wonderful. Okay. So and then we've got after Megan's presenter, we've got some a presentation from ADPI, who are the Association of British Pharmaceutical Industry, and we've got Charlotte Rand from Cwm Taf Morgannwg Research Hub talking about their annual report. So over to you, Megan.
Thank you very much, Dr. Good afternoon, everyone. I'm Megan Mathias. I'm Chief Executive of something called the Moondance Cancer Initiative. And if you've never heard of us, that's absolutely fine. We are a startup. We're new kids on the block. And this is a fantastic opportunity for me to take a few minutes of your time to explain what we're trying to help achieve in Wales, and how we're working, what we've done so far and where we might be heading. So the starter for 10 is that we are a not-for-profit organisation based in Cardiff with a Wales-only remit. We are really fortunate to be philanthropically backed. So we've been funded by the Moondance Foundation, which is the family philanthropic foundation of Deanne and Henry Engelhardt. Henry was one of the co-founders of Admiral Insurance, and we're lucky enough to have been given a substantial amount of money in the tens of millions to help promote more survival outcomes in Wales, very simply, to help fewer people die from cancer in Wales over the next 10 to 15 years. Priya, next slide. Thank you very much. So as a new organisation, I think the first thing that can be really helpful is to show you who on earth we are. So we're a really small team and we're not intending to grow particularly. So on the top row here, you've got the core team of us. Hopefully my picture's similar enough to me, even though it was a few years ago, that you recognise me. Jared Torkington on the left is our clinical director. We're delighted that he's joined us a couple of months ago. You've got Wendy Evans there as our delivery manager and James Baker as our research associate. And you can contact any of us at any time. Our details are on our own website. I won't go through all of the names, but it's really what I'm trying to show on this slide is that we've got a board. We have in the middle there, you can see Deanne and Henry as our founders. And our board is a mix of lay members and clinical members. Some of you who are active in, yep, Waterloo Foundation's great, very true, Andrew. They're also doing some fantastic work. For those of you involved in cancer services, you might spot Tom Crosby, who's also got another rather larger hat as clinical lead for cancer services in Wales, and has been very helpful in informing what we do amongst all of our board colleagues. So why are we here? If you could turn to the next slide, thank you. So look, this is starting at the very beginning. We're in our 10th month as an organisation, so we're starting, taking the chance to take stock and think about strategically what we want to help achieve. And I'll keep saying help achieve because we know that we can come with some money and some insight, but we're not going to achieve anything. We're going to be working in partnership with people across all health boards in Wales and partner organisations. So cancer is the single biggest cause of premature death in Wales. Some of the key statistics, even prior to the COVID-19 pandemic, were that we're looking at having by 2030 more than 200,000 people in Wales living with cancer. We're increasing the number of people diagnosed with cancer by about 2% a year. Obviously, that's averaged out. More people are going to die a premature death from cancer than most of the main other chronic conditions put together. So we're really committed to helping to reduce mortality, helping services to be as good as they can be in supporting people with cancer, not only for the sake of the people we know and love with cancer. We're all going to sadly know people in our friends and family who will suffer from cancer. It's that if we can be as good as we can be as the NHS in Wales on cancer, that will have massive implications for the NHS overall. If you could turn to the next slide. So very simply, our mantra is that fewer people should die from cancer in Wales. And it's very easy at the top line to say it, but it's helpful for us to keep that as our absolute focus for the next 10 to 15 years. And our commitment to that means that we've got to be committed to tackling the inequality in outcomes in cancer in Wales. There are vastly more people in our 20% most deprived communities versus our 20% least deprived communities who are dying from cancer. So reducing the overall numbers of premature mortality in cancer is a social justice issue, and that's another reason why we think it's so important to focus on. So what are we doing about it? If you could shift on. So broadly speaking, we work in a number of different ways, and for those people I've spoken to previously about this, we are very conscious that we're a new organisation. We're learning huge amounts in the conversations we're having, in the projects that we're starting with partners, and so this may change. We're taking a conscious kind of 2-year startup strategy to say this is what we're going to do, and then we're going to take stock, and we may need to work in different ways. But for now, we are a funder. We fund and support what we call demonstration projects, whether they're around pathways, practices or new technologies, so that more people in Wales survive cancer. So we're partnering with health boards to bring those in, and for some of those projects, we're likely to help fund some of them to scale as well. To a certain extent, we are very keen to hand them over to health boards once they've proven themselves clinically in terms of patient experience and, of course, economically. We're doing that very much in partnership. So if there's anyone who thinks their work might be relevant on this call to what we're trying to achieve, we'd be delighted to have a conversation with you after this. We know that we have potentially quite an unusual position in the system, being an independent party, so we might be able to broker new relationships that can assist in accelerating progress on better cancer services and outcomes, and we're happy to think about how we use that. Our work is evidence informed, rigorous and adventurous. The reason we're saying that is, again, because we've got this privileged position of being philanthropically funded, we are able perhaps to get involved in projects not clinically risky, but that might be corporately a bit more risky than mainstream services are able to do, particularly at the moment. So we're really keen to do that. A good example that Jonathan's kindly been involved in as well is we're just funding now a project to introduce transnasal endoscopy into Wales, and that's in partnership with 2 health boards and a private sector partner, and hopefully we can demonstrate the value of that together, and it can be adopted by not just the health boards participating now, but by others as well. And we're trying to do this in an intelligent way, which means we need to understand the evidence base. We need to spot where the gaps are. We need to understand what's known and proven, but also what might be coming down the line. And we're just starting up our programme of work around that at the moment. So some practical examples, if you could go to the next slide, or is it that way? Not sure. So we're 10 months in. We've committed so far over £3 million worth of funding to projects across the country, and that's to over 9 projects. I say over 9, I'm not being very specific because we've got a couple that are coming through now, hopefully, but we haven't completely got to that point of confirming funding. And our Insight programme of work is underway to help inform what we do. So we're doing our own research and insight work. We're very happy to publish that so that other people can learn from it or dismiss it as they see fit. But we'll try and learn in an open way because there's so much that we can do together to improve cancer outcomes in Wales, where there's no benefit to us to hide anything that we're doing. So that's the headline 10 months in for us. Some of the detail is on the next slide, Priya. Wonderful, thank you. So this is a snapshot of our current projects. We are so far focused on GI cancers. So we've got a bowel cancer programme going. We are building up a programme of work to improve upper GI cancer outcomes. Transnasal endoscopy sits in there. We're in some really encouraging discussions around trialling cytosponge in Wales as well. We're also funding further development of the Wales's Rapid Diagnosis Centre model with the team in Swansea Bay. And for colleagues who are either in Betsy Cadwallader or Haldar health boards or working with them, we're working in a slightly different way. We're funding some innovation time awards for both of those health boards, which is us admitting that we don't know what the answers are. So we're putting the question out to staff and partners of those health boards to say, what could you introduce in 6 to 12 months will make a significant difference to cancer outcomes in your area? And that's open for applications now with a closing date of the 16th of September, with aim to make those awards by the end of October. So we're trying to work in different ways. Mainly the way our projects start are through conversations, just through talking to us. Our particular focus right now, as I've said, is on upper and lower GI. We are expanding beyond that. I mean, we're only in 10 months, so give us a chance, but we are very much interested in particularly the larger volume cancers, such as lung cancer is another area that might be useful for us to move into. We are particularly focused and interested in helping early diagnosis and early detection of cancer, and actually people presenting to services earlier for any public health colleagues who might be on the call. That's pretty much our area of focus at the moment, but we're very open to wider conversations. And the 3 projects listed there are insight projects. That's the start of our own insight work going on. We think there's a really exciting 5 to 10 years coming up in early detection and diagnosis. So we're trying to understand what the roadmap might be for Wales, whether that's novel diagnostics combined with new organisational models. What does that look like is a question for us to know where the health boards are going in order to know how we can help with that. Awareness and presentation services I mentioned, and frankly we're just trying to get our heads around the complex field that is cancer tech at the moment, and doing some of our own research into that. So we're here, we are a independent enabler catalyst of improvement, and we're really keen to just build our connections and build those rich conversations at the moment. So delighted if you want to get in touch. Priya, the last slide is a shameless advert for There's My Email, and that's our website. I'll stop. I've rattled through it quite deliberately, buying time for Jonathan, but also hopefully to be able to answer some questions if that's useful.
Yeah. Megan, thank you. So I've also put the website in the chat for anyone who wanted to look at it. And yeah, I've been lucky to start working with Moondance on the project that Megan mentioned, and it's fantastic. It's great to kind of see someone like Moondance in this space and keen to learn and really develop and willing to start conversations. So we do probably have time for one question if anyone has a relatively quick question, but I know we can send out details and about for conversations after the meeting. So does anyone on the call have a question for Megan and about the Moondance initiative or some of the projects? Ooh, Henrietta, do you mind introducing yourself?
Hello, my name's Henrietta. I'm Air and I'm from Fusion Digital Health. We're a startup in Wales, and it's a very fascinating and interesting project. I just wanted to know, you mentioned the health boards that you're looking to have some sort of 6 to 12 month quick responses to. Where would you find out what those challenges are and what solutions or challenges that you might be able to we might be able to respond to?
Thank you for asking. I knew I'd missed stuff. So it's all on our own website. We are, each of the Betsy Cadwallader and Haldar innovation departments are also, we've partnered with them on these, and they're running webinars on as well on different dates in August, so that people can find out about them as well and ask us more detailed questions about it.
Oh, great. Thank you very much.
No problem.
Brilliant. Thanks, Henrietta. OK, so I'm gonna move on to the next presentation. Megan, thank you for joining us, and please feel free to join us in our next meetings. But we'll send a link to the website and a thank you email, and I'm sure everyone's details are on there should they want to contact you. And Yeah, and you're on Twitter as well, so a lot of your stuff goes out on Twitter and Moondance Cancer Initiative. So yeah, follow those guys. Should keep up to date. Thank you, Megan. Okay, so we're going to move on to the next presentation. So we're running a little bit behind. We've got a bit of a buffer at the end, which is fine. So next we have Carolyn Heaney. Are you in the room? Oh, I can see you. There you go. Fantastic. Oh, ready to go. So Carolyn Heaney is the NHS Engagement Policy Partner for the Association of British Pharmaceutical Industry, which is ABPI. And yeah, Carolyn's agreed to come and talk to us a little bit about the the pharmaceutical industry project repository, which is quite an exciting repository that, yeah, really looking forward to hearing a little bit more about. So over to you, Carolyn.
Okay, thank you, Jonathan. So I think I'm sharing my slides. Can you see them?
You can, yes.
Good. Well, that's always a good sign. So I will take you through. It's just a couple of slides, just really as a prompt to remind me what I need to tell you. So I work for the ABPI. I'm a colleague of Joe Ferris, whose name you will more likely recognise than mine, who's based in Wales. For anybody who's unfamiliar with the ABPI, we're the pharmaceutical industry trade body for the UK. And we exist to help make the UK the best place in the world to research, develop and use new medicines and vaccines. So we're a membership organisation that represents the research-based pharmaceutical industries that are all-time developing in the discovery and development of new medicines and vaccines to be used in the future. So I work as part of the NHS engagement team in England, but have led this cross-functional project across the ABPI to develop a new repository to showcase the large amount of collaboration that's going on between our member companies and NHS organisations across the UK. So we've done it with teams from the ABPI across the UK, and Joe's been an integral part of that. So what it is, it is a single portal through which, for the first time ever, you can access and be signposted to a wide range of examples of collaborative working that's going on between our companies and NHS organisations across the country and across the Union. There are currently more than 50 examples in there. There's lots more examples of collaboration going on all the time, but this is a work in progress for engaging with our members to showcase an ever increasing proportion of the collaboration that is ongoing. And the idea is to showcase collaboration for what it's worth in terms of its ability to help support the spread and scale of industry partnerships, and to enable NHS and industry partners to benefit from each other in terms of helping to improve outcomes for patients and support the delivery of NHS goals. The way the repository is developed is that it's a single portal, as I've said. It shows NHS stakeholders how industry can contribute to the delivery of their goals and priorities. The way that it's designed is to be functional, enabling you to search by geography, so you can search by whichever devolved nation you're most interested in, Wales, Scotland, Northern Ireland or England, and within England you can search by NHS region or ICS. You can search by specific NHS organisation, by company or by project focus now. And the idea of this is to highlight the benefits of collaboration between NHS and industry and to build confidence around cross-sector collaboration. The ambition is to enable it to become the place where you go to as a reference platform to showcase all of the expertise and resources that industry is bringing to the table in collaborating with NHS partners, to enable people to pick them up and learn from them, and to identify potential innovations and different approaches to embedding innovation that can be scaled in order to create sustainable solutions across the NHS. So we've got a couple of screenshots here. Here we've got that's a screenshot of the landing page, which tells you a little bit more about what the repository is about. This here is a screenshot of a page where you access the individual case study pages. And so within the case study pages, you'll find just some very basic information about each individual case study, along with a link to where there's more information about the project itself that sits on the company's own website. So it's not just a portal to the wide range of projects that are going on across our member companies, but it takes you into our member companies' websites, enabling you to explore what, all of the other material that they've got on show to highlight the collaboration that they're doing with the NHS. So we launched the repository originally in March as a work in progress, in order to get some feedback from stakeholders, in order to help refine it a little further. We made some changes in light of that feedback in time to launch the phase 2 release of the repository, in time to launch it fully at Confed 2021 in June, which we did. So I've described the different ways in which the repository is searchable now, which includes around specific project focus. So if you were interested in a specific therapy area or disease area, you could look for projects specifically around that, or if you're interested in things that are going on in a particular area of the country. But of course, the whole idea of this is to be able to see beyond what's going on in the organisations that you know and are familiar with already, so that you can the organisations can learn from each other, and if appropriately shamelessly poach the innovative approaches that different organisations are taking to helping improve services and outcomes for patients. The repository is going to be a live resource, so it's not set in stone. It's both a work in progress in terms of what we've got at the moment is, relatively speaking, a starting point. It only shows a certain type of collaborative project that industry can undertake under the ABPI Code of Practice, called joint working, but we aim in the long run to showcase a much wider range of collaborative projects going forward. Specifically, for example, the new ABPI code, which was launched on the 1st of July, now has a new definition of collaborative working, which is broader and less constrained than the definition of joint working, and so the nature of collaborations that our member companies will be undertaking with NHS organisations as they start to capitalise on that new definition of collaborative working, that will the nature of collaborative projects will evolve, and we hope to be able to showcase those going forward. There's also a new requirement in the code for collaborative projects to, once the outcomes are known and there's data to demonstrate what the impact of the project has been, the code now requires companies to articulate those and make them public. So we will be looking to evolve the repository so that we're able to show the impact that collaboration has had in terms of the beneficial outputs, the outcomes that it's improved for patients. And it's also a work in progress in terms of bringing more and more companies on board, extending the breadth and depth of the examples that we're showing through the repository, in order to bring it to life as much as possible and enhance its utility and level of interest to NHS partners as we go along. So it's a watch this space. It's a really excellent resource. As I say, it's the first time that anybody's done anything like this, so it's significant enough in its own right that we've got it at all. But it's intended to be a starting point and for us to develop it as we go forward. And if you visit the repository on the landing page, you'll see that we are explicitly asking for feedback from anybody who wants to give it to us based on what they think when they go into it. So if you do have anything to feedback to us or suggestions that you'd like to make, don't hesitate to contact us. And there's an email address here on this slide, ABPI Collaborations Repository at abpi.org.uk. You can email that, or you can email me directly to let me know what you think or to ask any questions about the repository. So I will stop there and happy to answer any questions.
Brilliant. Thank you, Carolyn. So that I having had a really good look at the repository, is really good, and I think it really encourages us to kind of look at what everyone else is doing. If there are examples of really good collaborations or projects that have taken place across the UK. But I also think for some of those members who are quite new to that collaborative opportunity that comes with working within industry, it's a really good example to a way of going to look at what that could look like, or how that looks like in what that looks like in other projects. So I think it'd be massively valuable for individuals from looking at it that way as well. And yeah, really looking forward to it growing and supporting those who are looking to be interested in being part of those collaborative projects. Does anyone have any questions? We've probably got time for a quick question before we move on to our final speaker. Does anyone have any questions for Carolyn? I know Joe, you put the link in the chat, so that's there for everyone to look at. I think it's one of those things. I think when people go and have a little look at it, have a play around with it, and kind of we put your email out there, Alan, for people to kind of send you some feedback if they have it, and I'd encourage people to do that because it does really help with these repositories. Henriette, fantastic. Do you wanna ask your question, Henriette?
Sorry to keep asking. Just wanted to know, so are these collaborations that have happened, and if so, are you looking to promote collaborations that would like to happen?
They're collaborations that either have happened, so completed projects, or that are happening at the moment. So it's not intended as a portal through which for companies to seek collaborations, but by looking at case studies, you can get in contact with individual companies, and it's it's a platform through which you can explore potential collaboration with individual companies if you wanted to do that. But it's not in itself intended for that purpose.
Okay, thank you.
So we'll move at the hitter. I got a picture.
Okay, so we're going to Carolyn, thank you very much.
And
is somebody else trying to speak?
I don't think it was a question. I think unless I'm happy to be corrected. So, but I may have said we haven't got time for another question anyway. So, but Carolyn, thank you very much for joining us. We're really grateful for you telling us a little bit more about it. And yeah, hopefully everyone can have some time to go and have a really good look at the repository and yeah, be inspired and maybe kind of make some connections off the back of that. So yeah, fantastic. Thank you very much.
Yeah. Thanks.
Brilliant. Okay, so we're going to move on to our final speaker, and we've got Charlotte Rand, who's a project manager with Cwm Taf RIC Hub, and she's going to be telling us about the Cwm Taf RIC Hub and about their annual report and some of the outcomes and some of the pieces of information that came from that. So over to you, Charlotte.
Thank you. Can you see my presentation?
Beautifully, yes, fantastic.
Brilliant. Good start. So yeah, I'm Charlotte Rand and I'm the project manager for Cwm Taf Morgannwg Research Improvement and Innovation Co-ordination Hub, which is probably my most obscure job title to date. And basically, I am going to touch upon the annual report, but I'm just going to give a bit more of a overview of the RIC Hub and the other RIC Hubs as well that are across Wales. So the The hubs were outlined in a Healthier Wales policy, and each regional partnership board was expected to create one of these hubs that would identify, align and coordinate RI&I activity. What I would say about that is the pandemic massively impacted, our ways of working and our objectives for the couple of years that we had funding for. We implemented a team of 6 people, and that included project management, some engagement staff and communication staff. And whilst we are hosted within the Cwm Taf Morgannwg Health Board, we are focused on delivering the priorities of the Regional Partnership Board. So how we describe the RIC Hub from our point of view, for those who don't know, is that we identify and support regional research, innovation and improvement activity, and we steer collaborative regional partnerships. And one thing that we focus on strongly is bringing health and social care back together. So as you can see here, our ambition is to accelerate the shift towards higher quality and better value services, including new models of seamless health and social care. And how we've been doing that in some of the projects that we did last year is we've been working with a number of different partners to deliver on a number of different projects. So I've just put some pictures up here of some examples, but we are working with architects to develop the church on the Glanreed site to make that into a community hub. We set up the antibody testing for school staff last year and worked with the local authorities to test nearly 5,000 members of staff. And we worked with the Natural History Museum to bring art into the field hospital for the COVID patients so that it had more of a personal feel there, and a number of other projects that went on last year. I've put up some of the figures, and this is pretty much what the outcomes of our annual report were, and these are just the highlights from my point of view. As I said earlier, we're a team of 6 people, but we managed to make a really big impact last year, even with all the challenges that we faced. And these are just some of the things that my team has said were highlights for them. And it says we supported 20 projects, and what we mean when we say we support projects, we may be getting involved in the delivery of projects, the implementation, we may be looking for funding, or we may just be connecting and linking people together in order to support the delivery of projects across health and social care. We've also been working with Swansea University to map research improvement and innovation activity, and with Accelerate also, and the report, the final report is due imminently, which will be the drive for a lot of our work this year, particularly working on population needs assessments with the RPB. We'll be looking at where the hotspots are for activity, but also where the quiet parts are. And what we'd like to do is engage with those areas, because we don't believe that there's no activity going on. We just think maybe there's a better way to be reporting on it for the future of these sorts of mapping activity type things. So we have been working on branding and website development. We've done this alongside our communications manager, who's the communication manager for the Regional Partnership Board itself. So this has all been done as one big co-production piece of work. And what's been really good is that we've been involving members of the public in what they'd like to see. And so we've used our page on the website to promote some of the work we've been doing, some of the examples and the case studies. And I would encourage anyone to go and have a look, because there's some really good work going on within Cwm Taf Morgannwg. We've also implemented a stakeholder management system called Tractivity, and so this allows us to keep our contacts that are external to the health board, where most of our IT is held. It allows us to send multiple sort of emails, surveys, different sort of things where we can engage with our stakeholders on a more of a collective effort, because one of the barriers we did face, and I'm sure the other RIC Hubs face, is that being hosted by the health board or by the local authority does bring those what seem like simple things to send an email to someone in an organisation externally. one of the things that we find most difficult, in fact. And we're also setting up, well, we've set up our Twitter, and we are building some followers, but I've put that as a shameless plug there so we can gain some more followers from the network today. So looking forward, we do only have up to March 22 as funding, and we are hoping to be further funded, particularly within the Regional Partnership Board. We'd like to work with them to deliver on their Welsh Government priorities, but particularly working with them to engage with some of the other networks that they run. So we're looking at housing, we're looking at young persons network, the older adults network, learning disabilities, and some of the other work that they've got going on, that really we want to be the bridge between them and the health board to bring these services together. We're going to use the outcomes of the mapping exercise to drive some of the actions that we'll do over the next few months towards the end of our funding. And we're continuing to develop the church as a community hub in Glanreed, and that's going to be a really big project, and something I want to bring back at some point at a later date when we've had some more progress there. And we're also working with Get Fit Wales. Just wanted to mention this one because it's a really good project where we've provided Fitbits to families in Merthyr, and we've been working with Scott Tandy from that company to get those out to families where they're earning rewards from getting fitter. And I think that's a really good project in terms of population health, and something that we've been eager to get into. I just want to acknowledge some of the other companies that we've been working with. We did an education project in Merthyr also this last year, which is ongoing, but we've had really good relationships built with some external companies that really do deserve the credit for some of that. And that's pretty much it. But I did want to just mention that there are RIC hubs across the region, and I'm not sure if they're represented here today, Jonathan, but I think that it would be a real benefit to get the RIC hub sort of involved in this sort of setup, because we are all sort of working towards a collective aim. Listening to everyone today, it really touches upon some of the meetings that I go to throughout my normal day-to-day work, and I think everyone is working towards the same ambitions, and it'd be nice to get those ambitions aligned, I think.
Brilliant. Yeah, absolutely, Charlotte. And I think, like you say, there are RIC hubs right across Wales and across the other regions, and who will be doing different types of projects and taking a different way of, going at this in a different way. So depending on those on the call, which region you belong to, there'll be different representatives, different members of that team, and they'll be setting themselves slightly different different goals, and albeit working towards the same end goal, which is to improve that population health and for people living in the community of that region. So you guys are doing some really good stuff, and I know you're really active on Twitter as well and can keep up to date with what the guys are doing. I had two questions. So just for the group, you mentioned Regional Partnership Board a few times. Do you mind just giving everyone an overview of what the role of the Regional Partnership Board is?
Yeah, absolutely. So the Regional Partnership Board is the delivery board, then, I guess, of a number of different services. I would say it's the umbrella over health and social care and the community voluntary councils, and they're delivering on some of the key priorities for Welsh Government, like the population needs assessment, and some of those other key reporting functions that need to be done in order to commission services across health and social care. So I do believe every region has a Regional Partnership Board, and then I think that they report sort of nationally then as well into Welsh Government.
Wonderfully put. Wonderfully put. So they are really good to know about the Regional Partnership Boards, because I think they're also doing some really good work, and the work you guys are doing also feeds into that. So there's a number of them that do have websites, so it's worth looking at that and just having a little bit of a background look at that. I suppose the other question I had is, for the people on the call, how can they engage with you as a RIC Hub, and what are the kind of things that you want to be hearing about, or that that you may want the members to engage with you about, as for Cwm Taf?
Yeah, so I mean, in terms of what we do, I know we've got research in there. Research is very much something that we don't tend to touch upon much. There are research teams, and that's what they're there for. We've mapped their activity, but we are certainly looking for examples of improvement and innovation within health and social care, and particularly examples of collaboration. And really, if anything is happening across Wales or even outside of Wales that would be a benefit to our population, that's the things we want to hear about. Coming to these events is incredible. We see really good examples of these sorts of things, and it gets our ideas flowing about what we could do, how we could adapt something to suit the needs of Cwm Taf Morgannwg. And I haven't put my email on here, but if anyone does want to contact me, it would either be emailing myself, or we are really active on Twitter, as you said, and anyone can contact us through there with examples of innovation, or even if there is anyone within the region or outside that wants to know a bit more, would want to work with us to bring health and social care together. That's where our interest lies, is bridging those gaps between the two. We touched upon it earlier in the breakout rooms, about the values-based stuff and what we do for prevention and those sorts of things, but ultimately bringing local authorities together with the health board, which has been done really well over the pandemic. I will say I was really impressed. I'd done a lot of work with the Test, Trace and Protect programme, but I think that same sort of coming together attitude needs to be adopted now across the board for all sorts of services.
Yeah, absolutely. And Elizabeth's been kindly been putting all the links and the emails and the Twitter handles into the chat for anyone. And I think you're right. There's a lot of synergy that is kind of taking place in health and care, and I think it's teams like yours and across Wales that are really trying to bring those things together in a way that is meaningful for what at the end of the day is a person, isn't it? It's a person at the end of that, and a population that those services are trying to serve, and to support. So
absolutely.
Brilliant. Okay, wonderful. So I've taken up a few questions there. Did anyone else have any questions for Charlotte? So we've probably got time for maybe 2 questions before we finish up for the afternoon. Did anyone have any questions?
Hi, Charlotte. Sorry, I was about to put my hand up there, Jonathan, but I fumbled. Hi, Charlotte. I was just interested in that sort of CRM package. What's it called?
Tractivity.
Tractivity. How have you found that? Because that's something I've been thinking about myself. And is it off the shelf? How much does it need to be customized? What's the reality of using something like that?
I can't take any credit for finding Tractivity. We've got a brilliant communications manager, Rebecca Goodhand. I don't think she's joined today, but we looked at a number of different CRM systems, and Tractivity was the best for us. But I'd be happy to send you her details, because I think she'd be much better at letting you know what all the good it does and all the benefits of it. So I can get in touch with you outside the meeting if you like.
That'd be brilliant. Thanks, Charlotte.
No worries.
Appreciate that.
Thanks, Mark. I think that that question about trackability is one of those challenges that we all have. Is how do we communicate with people who don't sit within our organisation, who have, who we want to tell things about, and we want them to be able to tell us things. So it is a big challenge that we're all experiencing. I think as the communication channels do go more digital, but it's good to see that there are little solutions popping up here and there, and if we can share that across the network for the experiences, that's fantastic. So okay, so Charlotte, thank you very much, and I'm sure people will kind of be getting in touch and looking on the website and following you on Twitter now, because to keep up with what you're doing, and we will share the report as well with the members after the meeting as well, so they can have a little look at that in a bit more detail. So yeah, keep up the good work, and thanks for coming to join us today. So we've come to the end of the meeting, and I'd like to say thank you to everyone for joining us, and you know, like I said earlier, we are really trying to work to get things as meaningful for you as members, to really kind of focus on the things that are important. It is a big ask, and there are lots of, you know, there are priorities that will be different for each of you as members and organisations, but it's about finding that happy medium where we can really focus on what's important to all of us. And I think there's a bit of me that feels like that is the person that we're all trying to help, which is the person at the end of these solutions and the end of these services. So we have our next meeting, so that is going to be in November. That's going to be the 9th of November. So it's if to get that in your diaries now. So there's going to be 1:30 to 4 o'clock. So same time. We've got it a little bit earlier this time this time just because it's going to clash. So the November October is quite heavy for bigger kind of events and conferences and meetings. So we brought it to the 9th of November. So we will get that that invite out a bit sooner, closer to the time. But yeah, thank you everyone for joining us, and thank you for taking part in the breakout and in the Mentimeter. And if anyone would like to kind of would be interested in being part of, when we do get that Simply Do platform into a place where it's ready to have a play with, if anyone is interested in trialing that out with us and feeding back, then do get in touch. Thank you to all our speakers, and you know, we've kept to time, which is good. So thank you to everyone for sharing all their information, and thank you for all the questions. And yeah, thank you for another brilliant meeting, and we'll see you in another couple of months for when hopefully there may be some more developments on the stuff we've been talking about today. So thank you very much everyone, and have a good afternoon, a good evening, and we'll see you all very soon.
Thank you.
Thanks, John. Cheerio. Bye bye.
Bye guys.
Thanks, John.